everyone. I am Mary Cheyenne Q. Bagao, a student physical therapist of the University of Bohol, and in this presentation, I'll be talking about something that impacts most everyone at some point in life: low back pain. We'll go over what it is, what causes it, and how physical therapy can help you manage it safely and effectively without relying on medication or surgery. So, first, we go to the prevalence and causes. Did you know that nearly 80% of adults worldwide experience low back pain at some point in their lives? It is one of the most common reasons people seek healthcare. Common causes include poor posture, muscle imbalances, herniated disc, and degenerative spine condition. Sedentary behavior, improper lifting, and job-related stressors often make it worse. As physical therapists, our job is to identify these underlying causes and help you correct them before they lead to chronic issues. Acute versus chronic low back pain. Low back pain can be acute or chronic. Acute pain comes on suddenly, maybe from a sprain or strain, and typically resolves within 6 weeks. Chronic pain lasts longer than 3 months and often develops gradually. It requires a more comprehensive long term strategy. Physical therapies adapt treatment based on which phase you're in, focusing on early movement and relief in acute stages, and strengthening education and lifestyle modifications for chronic pain. Non surgical treatment options. Most low back pain can be treated without surgery. Physical therapy is a top choice. We use exercises and hands on techniques to strengthen your core, improve flexibility, and correct posture. We also incorporate non pharmaceutical strategies like heat, ice, electrical stimulation, and relaxation methods. Lifestyle changes like adjusting how you sit, move, or work can make a huge difference in long term recovery. So, when you go visit a physical therapy, at your first visit, a physical therapist perform a thorough evaluation. We look at your posture, mobility, strength, and movement patterns to figure out what's really going on. Based on our findings, we create a personalized treatment plan tailored to your specific goals and lifestyle. We reassess regularly to track your process and adjust as needed. It is a collaborative process. You're in charge of your recovery, and we're here to guide and support you in every step of the way. Low back pain affects people differently depending on their age. Children and teens often develop pain from poor screen posture, carrying heavy backpacks, or improper sport techniques. Young adults may experience it from long hours at a desk, incorrect gym form, or work related stress. Middle aged adults face issues from repetitive bending, yard work, or lifting children, often with a declining core strength. Older adults may deal with arthritis, deconditioning, or balance issue that increase spinal stress. As a physical therapist, we tailor strategies for each life stage. So for treatment techniques, there are no one size fits all approach. We use a mix of manual therapy like joint mobilization and soft tissue massage, therapeutic exercise to build strength and flexibility, pain relief modalities like heat, ice and electrical stimulation, and posture correction to reduce stress on your spine. Each, each session is built around your needs and comfort level. Education and prevention. Education is a huge part of physical therapy. We teach how to set up your workspace ergonomically. For example, at your desk, make sure your screen is at eye level and your feet are flat on the floor. How to lift objects safely using your legs, not your back. So, when lifting, bend your knee, keep the load close, and engage your core. And how to incorporate healthy movement habits in your day, like taking breaks from sitting, stretch regularly, and be mindful of your posture. Simple daily changes like stretching every hour or adjust how you sit can prevent back pain before it starts. Sometimes low back pain is a sign of something more serious. Seek medical attention immediately if you experience pain with numbness or tingling in your legs, loss of bladder or bowel control, fever with back pain, or pain after a fall or trauma. This could signal nerve compressions, infection, and more severe issue. Physical therapy has several advantages over other treatments. It is drug-free approach, so you avoid the risks and side effects of long-term medication use. It's cost-effective, especially compared to surgery or recurring specialist visit. Most importantly, physical therapy empowers you with self-management tools. You learn how to care for your body independently and confidently. Prevention strategies. Physical therapists teach practical tools to reduce risk of developing or worsening back pain. So first we have core strengthening to support the spine, ergonomic adjustment at your workstation, proper lifting mechanics like keeping object close and using your legs, and daily movement routines such as posture awareness and regular position changes. These proactive steps help you stay mobile and pain free. For chronic and recurring back pain, physical therapy focuses on sustainable strategies including gradually progressing exercise program tailored to your ability, mindfulness and pacing techniques to manage flare-ups, relaxation methods like breathing exercise to reduce tension, and habit training so you can avoid harmful movement and promote healing. It is all about building lifelong habits that support your back health. So that's the end of the presentation. To wrap up, physical therapy is safe, natural, and empowering way to treat low back pain. We don't just mask the symptoms, we help you understand the cause, fix it, and prevent it from coming back. Thank you for watching. If you have questions and want to learn more about physical therapies too, feel free to reach out. Thank you.